Okay, everybody, Dr. Rayfish from Vet Triage. We are going through this issue of JAVMA from June 1st, 2015. We are talking about brain MRI and traumatic brain injury. Here we go. Results of MRI performed within 2 days after head trauma in dogs and associated with outcome in 18 cases. The objective is to review results of MRI within 2 days after head trauma in dogs. This study comes out of England. It's a retrospective study, 18 dogs. So right away, again, I want to have a higher number of animals, ideally. And ideally wouldn't be retrospective, but that's fine. Results were 2 dogs were euthanized, 1 died, 1 had major persistent deficits, but the remaining 14 dogs had good outcome, including 9 that recovered completely and 5 that had minor persistent deficits. The most common MRI findings were intra-axial changes in 13 dogs. So again, I really don't like when they don't use percentages. Intraaxial means within the parenchyma of the brain versus extraaxial, which is outside the brain. An extraaxial hemorrhage was seen in 13 animals. Intraaxial changes were best seen on T2 weighted fluid attenuation inversion recovery images. That's FLAIR, FLAIR. That's a sequence of MRI. There's many different sequences of MRI that the technician can coordinate when they're running the MRI. And FLAIR is one of them. A mass effect was detected in 9 dogs, 6 of which had a midline shift at a mean of 2.18 millimeters. 3 dogs had transtentorial herniation, 2 had transcranial herniation, and then extraaxial hemorrhage was best seen on FLAIR. The most common location subdural, with subdural extraaxial hemorrhage most often seen on the same side as the injury. Epidural hemorrhage was seen in 2 dogs. The affected area was larger in these dogs than in dogs with subdural hemorrhage. 1 dog required surgery, the other was euthanized. Conclusions. Results suggest that dogs with less than 48-hour duration head trauma on T2 weighted and FLAIR images provide the most diagnostic information. Dogs with injuries to the caudal fossa, so the caudal fossa is this area here where the cerebellum sits. And of course this is called the cranial fossa here. So dogs with injuries to caudal fossa or affecting both the rostral and caudal fossa have poor prognoses. Okay, introduction. A study of patients undergoing surgery because of traumatic brain injury, for example, identified 7 factors related to the likelihood of death during the perioperative period, and this is in humans. Patient age, extent of lesion, bilateral absence of pupillary light reflex, the Glasgow Coma Scale score before surgery, the extent of midline shift on CT, the type of surgery, craniotomy versus craniectomy, the time between injury and surgery, and the presence of acute brain swelling at the time of surgery. Intracranial changes associated with head trauma can be divided into primary and secondary injuries. Primary injuries occur as a direct result of the initial trauma and can include contusion or hemorrhage in intraaxial or extraaxial tissue, and diffuse axonal injury in the parenchymal tissues. Secondary injuries, changes due to swelling and inflammation that occur in the brain as a response to the initial injury, and changes that develop as a consequence of elevated intracranial pressure. All right, materials and methods. These dogs underwent propofol, isoflurane, oxygen. They had the MRI magnet strength between 0.4 and 1. The lower the magnet, usually the poorer the images. Sagittal, so these are all the images they ran and how long each scan took. Sagittal T2 weighted images, 3.56 minutes. Dorsal T2 weighted images, 4.26 minutes. Transverse T2 weighted images, 4.2 minutes. Transverse FLAIR images, 5.29 minutes. Transverse T2 star gradient echo images, 3.5 minutes. And transverse T1 images, 4.28 minutes. Transverse T1 weighted images were, in some patients, given gadopentanate dimeglumine at 0.2 mg per kg or 0.09 mg per pound IV in some cases. Extraaxial changes considered most likely to be extraaxial hemorrhage were classified on the basis of anatomic location as epidural, so lentiform and ellipsoid, subdural, which is crescentric and concave, subarachnoid, which is linear or convoluted and extending into the sulci. In addition, extraaxial hemorrhage was identified as occurring on the same side as a blunt trauma based on the soft tissue injury, and that's called COUP, C-O-U-P. I'm assuming it's COUP and not COO. or on the opposite side of the soft tissue injury in the brain, contracoup or contracoup. To identify secondary changes, images were evaluated for the presence of a mass effect. Mass effects were categorized as a rostrocaudal shift, including either rostral or caudal transtentorial herniation and foramen magnum herniation. So transtentorial is between the rostral and caudal fossa, and then foramen magnum herniation is through the foramen magnum located here in the back of the skull, at the base of the occipital bone. So mass effects were categorized as rostrocaudal shift, including either rostral or caudal transtentorial herniation and foramen magnum herniation, or subfalcine or midline shift, and herniation through a skull defect. Outcome was classified as complete recovery, partial recovery with minor ongoing deficits like persistent neurologic deficits evident during clinical examination that did not substantially affect the quality of life, or partial recovery with major ongoing deficits like persistent deficits evident during clinical examination that substantially affected the quality of life, or death, meaning they died or were euthanized. Okay, here's an example of midline shift here. So this is an MRI, and there's a line down the middle showing midline, and then that little horizontal line by B that's showing the shift, the amount of shift. Results. The age of the animals, mean 2.4 years of age, body weight, mean of 8.7 kilograms or 19.1 pounds, mostly male, mostly mixed breed dogs, mostly road traffic accidents. Second was blunt object trauma or head compression, like being stepped on or being hit in the head with a ball or a plank. At the time of the initial examination, 11 out of 18 dogs were obtundant or stuporous, 5 lethargic, 2 had no CNS deficits but underwent MRI because of visible head trauma or peripheral neurologic deficits. Most dogs showed up non-ambulatory tetraplegic, also had epistaxis. Surgeries performed in 4 dogs, 1 for intracranial decompression, 1 for spinal fracture stabilization, and 2 for orthopedic fracture repair. Another dog had a splenectomy. 4 dogs underwent surgery, survived a discharge. All 4 dogs that had surgery survived a discharge, and then the remaining dogs only received medical management. And so here is another example of a transverse MRI images showing contusion. A is gonna, I'll show you here. So it's gonna be hard to see, but A, which is the one, opposite side, right there, this one. You see the hyperintensity at the top of the skull there. See all that white stuff at the top, contusions, and you can see that arrow there pointing to another sequence, hemorrhage there in the parenchyma. So in that image, A has a T2 weighted image with hyperintense cortical contusions within the gyri. B was a T1 weighted, and then with more parenchymal changes. And then C was a T2 star gradient echo image showing presence of hemorrhage, like we said. 14 dogs, good outcome. 9 had complete recovery. The Glasgow score was a mean of 12.75. This is the Glasgow coma score. The higher the score, the better the condition. Intraaxial changes or parenchymal changes were seen in 13 dogs. Hyperintensity on T2 weighted and flare images were best seen for intraaxial changes. There was no abnormal contrast enhancement. Changes were seen as a signal void, either solid or onion skin-like layers on T2 star gradient echo images in 7 out of the 13 dogs. Parenchymal signal changes were identified in the gray matter in 7 out of 13 dogs. And in regard to extraaxial changes, hemorrhage was seen in 13 dogs, best seen on flare as a layer of hyperintensity surrounding the parenchyma. Hemorrhage was described as subdural in 9 dogs. And then 2 dogs with epidural hemorrhage had a greater amount of bleeding and greater mass effect than dogs with extraaxial hemorrhage in other locations. And so this here are examples, transverse MRI images with subarachnoid hemorrhage in an area of hyperintensity extending to the sulcus was more evident on flare. So that's this right here, all this inflammation here, and this line right there. And that was more evident than like T2 weighted. You can still see changes here, but it's not as dramatic as this one. And this line here is a bit thicker and more bright than this one. And then so note the concurrent cortical contusion in the right piriform lobe, right there. Okay, what's unfortunate with these, they don't label left and right, but this is the piriform lobes here and here. Okay, other intracranial changes. Mass effect with midline shift in 6 dogs. The degree of midline shift ranged from 1.7 to 4 millimeters with a range of 2.18 millimeters. 5 dogs had herniation. Parenchymal changes affected the rostral fossa in 12 dogs. Parenchymal changes also affected the caudal fossa. And then in these images down here, these are both T2, or these are both sagittal MRI, 2 dogs. So A1 is a T2, right here. A is a T2 weighted image of a dog with contusions in the cerebellum. So this white area here in the cerebellum. And rostral, transtentorial, and caudal foramen magnum herniation. So there's a little poking out right there, and also the swelling here, past the tentorium. And then for B, this T2 weight image, you can see this brain parenchyma sticking out of the skull. They think this was a persistent morula in the dog, and so it was probably born with this, and so the brain just went out that area because of all the pressure. But it had herniation. This dog had herniation there to the skull. All right, concurrent osseous and soft tissue injuries, fractures of the cranial vault was seen, orbital trauma, frontal sinus trauma, nasal trauma, all typical with head trauma, mandibular or temporomandibular joint injuries. All dogs had some soft tissue injury. T2 star gradient echo and T1 weighted sequences are most helpful in identifying the bone trauma. Soft tau inversion recovery sequences were helpful with soft tissue trauma. And then let's see here. Then these images I'm going to show you. In A, there's a Coop injury. So I'll show you that the soft tissue injury was on the same side as the brain injury. And then B and C had counter Coop, where it was opposite. So you can see right there, top 1A, see those arrows? The top arrow shows that there's soft tissue injury, and the bottom arrow is in the brain showing it's on the same side. Whereas in this dog here, the top arrow in B is where the soft tissue injury is. And then in C, this is so ghetto, in C you see the brain trauma on the opposite side in that dog. Okay, discussion. Results of the present study suggested that in dogs with acute, less than 48-hour duration head trauma, T2 weighted and FLAIR images provide the best diagnostic information. Dogs with injuries affecting the caudal fossa alone or affecting both the rostral and caudal fossa have poor prognoses. 1 second, guys. Okay. So dogs with injuries affecting the caudal fossa alone or affecting both the rostral and caudal fossa have poor outcomes. Primary interaxial changes were seen in 13 of the 18 dogs in the present study. Surprisingly, although all of these patients had hyperintense changes on T2 star gradient echo images, not all had characteristic signal voids on these images. This may have been due to the nature of the injury, so microbleeding or edema rather than hematoma, the timing of imaging early in the evolution of traumatic lesions, or the inherently reduced visibility of susceptibility artifacts with low field MRI. With peracute and acute injuries, red blood cells and hemoglobin are iso-intent or have low signal intensity on T1 weighted images, but have increased signal intensity on T2 weighted images. So the point is that when you have head trauma, when you catch it in the early stages, it's going to look different than when you catch it on the later stages on MRI or CT. And so you compare these sequences to find out what's the best. So it's a major interpretive factor when neurologists are looking at brain MRIs to figure out if this hemorrhage in there is old or new. One goal of neuroimaging in humans is to distinguish gray matter from white matter injuries because this distinction is associated with prognosis. 7 of the 13 dogs in this study had intraaxial changes in gray matter, but all recovered completely or only had minor deficits. These types of injuries can be referred to as cortical contusions, and human studies suggest that they have a better prognosis than diffuse axonal changes unless associated with a mass effect or an injury to the brainstem. Diffuse axonal injuries are injuries involving the white matter tracts. 3 degrees of severity are described in human patients. Mild is grade 1 with diffuse axonal Injury involving the gray matter, white matter junction of the lobar white matter only. Moderate is grade 2. Diffuse axonal injury involves lobar white matter and the corpus callosum. Severe grade 3. Diffuse axonal injury involving the same structures and the dorsolateral midbrain structures. Primary extraaxial changes were seen in 13 dogs in the present study, and changes in all 13 dogs were classified as extraaxial hemorrhage. Intracranial bleeding in the extraaxial compartments is potentially life-threatening even without concurrent parenchymal changes. Extraaxial hemorrhage is traditionally classified as either epidural, subdural, or subarachnoid. Epidural hemorrhage developed between the inner surfaces of the skull and dura mater, owing to the attachments between the dura mater and the cranial sutures. Epidural hemorrhage typically have a lentiform or ellipsoid shape. In humans, epidural hemorrhages typically develop on the coop side of injuries and rarely cross the cranial structures. They can, however, cross midline where the periosteum and sagittal suture are not firmly attached. Most often, they are associated with cranial fractures. Findings that may indicate the need for surgical evaluation or evacuation of an epidural hematoma include the thickness of the hematoma and midline shift over 5 millimeters. Subdural hematomas often develop from the cortical vein, but other origins include the pial vessels and the cerebral arteries. Subdural hematomas can be found either on the coop or countercoop side of the injury. Subdural hematomas causing over 10 millimeters of displacement have been associated with higher mortality in people rather than smaller displacements. Subarachnoid hematomas seen in 2 dogs in this study arise from damage of the pial blood vessels or from intraventricular hemorrhage. They occur as a result of parenchymal hematomas extending into the ventricular system from the subependymal vessels and will usually occur on the opposite side of injury. 15 out of 18 dogs in this study had intracranial, meaning intraaxial or extraaxial changes on the same or the coop side of the presumed side of impact, as determined on the basis of most severe soft tissue trauma. For human patients in whom countercoop or contracoop injuries are more common and may be more severe than coop injuries, in human patients the contracoop phenomenon is believed to result from differences in the density of the cerebral parenchyma versus the cerebrospinal fluid. It's been suggested that at the time of injury, cerebrospinal fluid moves toward the site of impact, displacing the brain on the opposite side so that more severe trauma to the brain occurs on the side opposite to the impact site. We speculate that the difference in prevalence of coop versus contracoop injuries between dogs and humans is due to anatomic differences, such as the more developed extracranial muscular mass surrounding the skull in dogs, as well as different shape of the canine skull compared with the human round skull. Another reason for the difference may be associated with differences in the types of injuries and the fact that dogs suffer fewer whiplash-type injuries than humans. Fluid attenuation inversion recovery sequences, or FLAIR, the decreased signal from the cerebrospinal fluid, making meningeal lesions more perceptible. Multiple studies involving human patients have found FLAIR images to be more sensitive for detection of hemorrhage in the extraaxial compartment compared with CT and with T2 weighted spin echo images. But the appearance will vary over time. They found in the study FLAIR is the best for extraaxial hemorrhage. Traumatic brain herniation is secondary to mass effects, and 9 dogs in the present study had a mass effect, including 6 with midline shift and 3 with transtentorial or rostrocaudal herniation. 5 of the 6 dogs with midline shift had a good outcome. Other studies have found that midline shift in MRI is negative prognosis. In humans with traumatic brain injury, midline shifts over 10 millimeters are associated with a greater prevalence of complications after discharge from the hospital. Another study found an increased perioperative mortality rate in patients with degree of midline shift. Another study found the degree of midline shift can be correlated with severity of traumatic brain injury. Trauma to the rostral fossa was seen in 12 dogs and associated with a good prognosis. Again, keep in mind the small number of dogs, so we don't want to overstep. These findings suggest that a caudal fossa has a poor outcome, as is the case for people with trauma in the posterior fossa. The changes observed included both intra and extraaxial injuries. The Glasgow-Coma scale is used to classify traumatic brain injuries in humans as mild, moderate, or severe. The modified scale integrates data from examinations of motor activity, brainstem reflexes, and level of consciousness to yield a score from 1 to 6, part of a total score ranging from 3 to 18. Using the modified scale as a prognostic indicator in dogs with head trauma has been studied In a study of dogs, patients that had a modified score of 8 or more have a 50% chance of survival in the first 2 days after trauma. For this study, the score appeared to be associated with outcome. The score should be used for prognostic purposes in conjunction with other parameters such as results of cross-sectional imaging and pupil condition, or as a method for assessing neurologic improvement. MRI is used in subacute stage, so within 3 days of injury, to diagnose ongoing damage, including axonal injury, although MRI is as sensitive as CT for identifying intracranial hemorrhage. The most common type of extraaxial hemorrhage was subdural hemorrhage, and extraaxial hemorrhages was seen most commonly on the croup side of the injury, both of which differ from patterns in human patients. In this study, they recommend that a FLAIR, T2 weighted, and T2 star gradient echo should be included because it was most helpful in this study. Finally, features that could be linked to prognosis included injuries affecting the caudal fossa or causing a marked midline shift, which were also associated with higher mortality or higher rate of persistent deficits, or with the need for surgery. Midline shift and transtentorial herniation have variable outcomes, but herniation through a fontanelle, which is that opening here that some dogs are born with and never fuse, is associated with a good outcome. Epidural hemorrhage were larger than other types of extraaxial hemorrhages, necessitating surgical decompression or euthanasia in 2 dogs in which epidural hemorrhage was identified. So yeah, good study. These types of things are hard to quantify. Even the small number of animals here, it's hard to collect that many, but very useful information. All right, we'll see you guys in the next study. Thank you.